The COMBINE Angina Study results were presented at the ESC Congress 2025 held in Madrid, Spain. The study aimed to evaluate the benefits of early addition of trimetazidine in patients recently diagnosed with stable angina who remain symptomatic even after first-line hemodynamic agent. This international, prospective, non-interventional study included stable angina patients from 5 countries, including India, between June 2023 to June 2024. Today we have with us Dr. Hanish Gupta from Life Aid Clinic, Delhi. Dr. Gupta enrolled the highest number of patients for this study from India.
Yeah, so that's a great question because when COMBINE Angina Study was brought to us, first of all, we were excited that it is a study about stable angina patients. And as you already know, that number of patients who are being in trial for stable angina are not as much as the number of patients who are being under trial for unstable angina. But stable angina patients are actually more in the population. So applicability of a study, vast-reaching consequences of such a study, a design of such a study, and also the scientific leadership of a very eminent personality like Dr. Professor Marzali. That was one of the clinching things because of which I got motivated to be a part of this study. Now, also at the same point of time, I wanted to be a part in a study in which we could have outcomes that could touch the aspect of everyday OPD care. So this particular study, it talks about early intervention, it talks about early care, and it also talks about saving the patients, the miserable aspects of loss of quality of life. Oh, it makes a lot of sense because primarily what has been done in cardiology is that metabolic agents like trimetazidine, they have been relegated till the end. What we have been essentially doing is that we have added hemodynamic agents, and hemodynamic agents would essentially reduce the workload, the heart rate of the patients, and we have believed that just because we have got tangible numbers and parameters by which we can view the heart rate of the patient, the pressures of the patient, and we can bring them down, then we believe that the hemodynamic agents have been doing something for our patients. But we have not been able to address the physiology of a heart which is getting starved. And in that, what we actually want to imply is that in such a scenario, metabolic agents have a huge role to play because metabolic agents would at the same point of time address the microvasculature. They would have to play a role in all the kinds of anginas which are not purely obstructive in nature. And if you ask me how many of those anginas are present which are not purely obstructive in nature, well, a huge number. If I have to put a figure, then probably 40 to 50% of our angina patients, they would not have an obstruction. They would have a physiological deficit somewhere in the heart which is not getting addressed. So we have been using trimetazidine as a last resort. Why can't we use it at the very beginning? And that's exactly what COMBINE Angina Study wants to bring out here. That why not use it as the first resort for your angina patient, see what the results are, try to find out that whether they are benefiting your patients or not, and in case they are, then of course try to use them early. It is actually, we would not be using it on an everyday basis on every patient, but definitely the SAC-7 score that we have, it has got very relevant questions to ask, and the patients can answer those questions on their own. And then it is a kind of a reinforcement for the patient themselves that if they are able to answer the questions in the questionnaire and they can see the results and match the results for themselves, then they will realize that whether they themselves are not getting any benefit or they are getting any benefit at all. So at the end of the day, SAC-7 score is a validated tool, it's a widely used tool, it's a standardized tool that can be utilized. And for a study like this, SAC-7 score was probably used primarily because it is so well known, standardized, and considering that this COMBINE Angina study was going from different geographies, from different mindsets, all over the world, it always meant that we could have a simplistic, easily applicable, standardized, widely used, and in many ways an accurate tool, which would be actually used by the patient themselves to answer the questions and finally derive at a conclusion from there. And that's a very wonderful question, and at the same point of time, it is a question that warms up my heart, because when we were doing this study, what we realized is that a lot of our patients were coming with very happy faces and a lot of confidence, and they had a lot of independence in their activities. So that might not just translate on paper, but at the end of the day, it does translate into everyday activity of life. So somebody who was not able to play with their grandchildren, they were coming back and saying that, this particular intervention that you have done on me, it has now empowered me to play with my grandchildren, and I can climb a couple of stairs more, and I am not taking as many anti-anginal pills that I was taking earlier. Earlier, I was afraid to go out of my house without having Sorbitrate in my pocket. Now I am not that much afraid. So these small things, these small changes, they may not be so much evident in studies, but as investigators, when we see our patients getting that relief, that is incidentally also another reason because of which we were able to contribute more number of patients, because as the study was going on, our confidence was getting reinforced for our other patients as well. Absolutely. In fact, Indian patients, they fared better than rest of the world. And we are more excited about this finding than ever before. Not only did our cohort was able to achieve a wide number of patients, it also translated into a better and more fair result for our patients. And our patients had lesser number of anginal attacks. They had quicker relief. They had from the CCS3, some of the patients came down to CCS1 category, and that was frankly speaking even phenomenal for us, spectacular for us. And as far as Indian patients are concerned, I think so very much relevant and very much applicable to our population. Combined Angina Study is not a study for me, it's a journey. It started with learnings for me. Learnings came from none other than a very widely acclaimed scientific figure like Professor Marzulli, and it was his words that you cannot think of angina in a tight water box. You cannot think of angina as a closed water compartment. You have to open up your mind. You have to think about not just anatomical representation of angina, thinking of it just as an obstructive disease, thinking of just obstructions in coronaries, arteries as the reason behind angina. You have to begin thinking of angina as a physiological entity. The study design was wonderful. We started with CCB or a beta blocker for our patient. We gave it for 15 days, and then we switched on along with that to a metabolic agent, trimetazidine. We had to see that whether this metabolic agent is able to bring relief to our patients, and bingo, it was able to bring a quicker relief, it was able to bring a faster relief, and also a wide-ranging relief. The patients were not taking short-acting nitrates anymore. So the clear-cut message, the one key takeaway that I would like to give my colleagues is that it's time that we start believing that we cannot relegate metabolic agents like trimetazidine till the last. You have to intervene early, you have to intervene fast for your patients, and you're not losing out anything because the patient is of stable angina, and that patient deserves to have an agent that can give him a better life, a confident life, an independent life, wherein they can have the best that life has to offer.